melancholic syphilitic. Similarly, sad, grief, suicidal, and philosophical patient, arrogant, poxinous patients, and close-mouthed and indifferent patients can be differentiated well. Surprisingly, all this classification on the cellular basis coincides with the classification of the symptoms in our text, both V.K. Sarkar, even in our other textbook of Organon of Medicine, clearly states that it coincides with, it is the text taken from the V.K. Sarkar. See the symptoms, everything coincides with that. And similarly, psychotic, similarly with the syphilitic. There was no classification of tubercular miasm there, but however he has disseminated some induration part. And what is the inference of this presentation? It is a miasm is nothing but a chronic state, that is a miasmatic state is an altered manifestation of the disease. It can be described as a dyscrasia, a diathesis, a predisposition. And it can be highly corroborated with the modern cellular theory, today's understanding. We know that the memory cells, for example, one infection, HIV infection or chikungunya infection, they leave some toxin in our body, that the antigen antibody reaction, and the B memory cells carries that. After some time, you might have listened to the post applications here. And the first Dr. V. Venkataraman has displayed that there is a message he conveyed that the rheumatology, that is in relation with the rheumatology and also with the skin diseases. He says that there is skin eruptions after some time. What does it? After some time, that the chronic miasmatic state, the imprinted protein of the miasma has developed the patient for eruptions, skin eruptions. Similarly, the C-reactive protein is high in that particular patient. In rheumatological patients, many chikungunya patients are developed that arthritis in which the patient C-reactive protein is more. That the message that the parameter of C-reactive protein is nothing but the immunological changes in the body, that is miasma. Miasma as per Hahnemann's interpretation. And here we come to the conclusion that what is miasmatic prescription. We know it is not a separate prescription, and the miasmatic prescription prescribing is a constitutional prescription based on the totality of symptoms, including the miasmatic state that inherited or acquired. That's more important. We have to look the patient whether inherited in the history of the patient, and in the family history we have to find out something, any inheritance is possible.